most famous physical therapist on the internet.
Howdy, folks. I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
Together we are the most famous physical therapists on the internet.
In our opinion, of course,
How'd
Bob.
you like it if I put my hand on your head?
Well, I was trying to tighten her skull down here.
Today we're going to talk about the top 3 signs of a rotator cuff tear. This is an updated video. We had troubles with it the first time when we did it. How many years ago?
Yeah, it's about 5 years ago. A little blurry, but this is we got a new camera person, new camera. We're better looking now.
That's right. Better. By the way, if you're new to our channel, please take a second to subscribe to us. We provide videos on stay healthy, fit, pain-free, and we upload every day. Also, go to bobandbrad.com. Go to the giveaway section. We're always giving something away. We're going to announce what we're giving away at the end of the video.
You can't go wrong with it.
Yeah, it'll also be fun. You can find it on Facebook, Bob and Brad. It'll be pinned to the top of the page. Go to Twitter or Instagram or TikTok if you want a 60-second version of our program. All right, Brad, go to work.
Rotator cuff. Now let's get the pronunciation right.
Right.
We've had patients come in and say, my rotator cup.
Yeah,
My cup is
Very
the cup of coffee, but we shouldn't make fun because it is rotator cuff, C-U-F-F.
and I've heard of cartridges too instead of cartilage, cartridges.
Yeah. So it's one of those things that therapists we get a little chuckle out of. It's all in
we're
fun.
amused.
So, anyways, the rotator cuff. Let's talk about. We know it's in the shoulder,
Right.
but it's actually kind of involved. But it simplifies to know what actually gets damaged.
Yeah, let's show this. Well, you're going to show this side first, Brad. Do you want to show the
Well, I was going to
capsule?
go here and just show the joint. You got the ball, a real shallow socket, and it's actually composed of the socket and 2 other bones from the acromion and the coracoid.
Yeah.
And it all fits in there. But then we have a capsule. It's kind of like it's some tissues that encapsulate it
place,
and hold it in place. And then we have the 4 rotator cuff muscles
Right. Let's
that support
flip
it.
all the way around here.
Oh,
So
yes.
you got 4 muscles. You can actually, to remember them, you can call them the sits muscles.
Sits.
S-I-T-S.
Yep.
So supraspinatus, and these are it right here.
Yep. This muscle right up above that spine bone.
Infraspinatus, that's the eye.
Yep.
Teres minor.
Mm-hmm.
And then underneath, inside here,
Between the shoulder blade and the rib cage,
rib
actually.
cage is subscapularis. Now, all these muscles help turn the shoulder out, turn the shoulder in, lift it up.
Right.
But they also stabilize this bone right into the joint.
Right.
It helps hold it in place. If you don't hold it in place like that, it's going to be sloppy and it's going to cause impingement.
Impingement.
Yeah.
There you go.
So,
Which
can cause
rotator cuff tears.
Yeah.
And impingement just happens to be an estimated 70% of shoulder pain. So that's why we're going to focus in on that. But my mic is falling off my ear, Bob. I don't know what to do about it.
Yeah, you're in trouble.
Yeah. Well, anyways, let's get back. Now, we do have the tendon of the supraspinatus, which is that impinged tendon in pink. Can you see that, Mike? Now, that's where we're going to find these tears. Okay, or I shouldn't say tears, but what I mean is there's 3 classifications of tears. And what we have here is if you lift up the arm, can you point that out, Bob, right where the impingement.
Oh, boy, you always like to do that.
Oh, that hurt.
Yeah.
Well, yeah, that's what happens. So the tendon can get pinched, and sometimes it's not a real bad pinch, but over time it wears
out.
Yep.
Yeah.
Or you could fall and have a real traumatic tear right away. Oftentimes that's not the case, so that it
Right.
happens over time.
It wears through, and it can be a partial thickness tear, which
Right.
means it tore partly through. And in that case, very rarely would not have surgery. at all.
No. You can do some therapy, allow it to heal over time, and things get back to normal.
It could be a full thickness tear, which means it goes all the way through the tendon. But that's not always necessarily as bad as it sounds, because it could be a pinhole tear.
Sure.
Just it goes all the way through, but it's very small.
Yeah, or maybe only 50% of it's tore, but it's
Right.
fully tore. So there's still some connection, but it's not functional. It's painful. There's issues.
Yeah, and they rate the tears that way too, by the percentage of how much, it's a full thickness tear, which with almost the entire tendon.
Sure.
And then finally is, if it's fully actually detached. So it's actually detached from the bone. Here's the supraspinatus. If that got actually, it's no longer even attached to the bone. that's a problem.
Yeah.
Because then it starts to retract and
Right. And I had a patient was fully detached. He left it. He did not have surgery. And the muscle here, you could see it was just concave. The muscle actually
yeah, it
atrophied.
deteriorated. It went away.
Yeah, there was just really no muscle belly there.
And he wasn't able to do much of his arm.
Yeah, he was limited, but he was about 75 years old.
So he got by.
He could function okay, not as good as he'd like to.
So what are the signs, Brad, that you have such a tear?
Right, so we decided to there's a lot of different tests.
Yeah.
But we picked 3 of them that we thought you could do at home. We're going to show you these. If one of them is positive and 2 are negative, that means you maybe not. If all 3 of them are positive, that's a pretty good sign you've got a rotator cuff tear.
Right.
But remember, you guys are not professionals. We are. So at least you have a understanding of the test, and you may do quite well with it. But you really should get it diagnosed by a professional to finalize this.
Right.
So
So what's the first one, Brad?
well, let's get Sam out of the way. Thank you, Sam. You did a good job. You didn't stutter or anything. Okay, the first one is the empty can test. This one's been around forever in the therapy world, and there's actually little controversy on how to do it, but we'll go through it for you. If you look at this straight out to your side, we don't want it there. You don't want it straight in front of you, but you want to lift your arm up at kind of a 45-degree angle. And you can see Bob has his thumb down, and that's where it got the empty can name from. It's like if you have a can, in Wisconsin, it'd be a can of beer. You tip it like this, and it would empty out. That's why it's called the empty can test. But now they say you can do it with the thumb up, so you can do it either way. Bob, you want to go up about halfway up. Now, if someone else pushes down on there and it very easily goes down, creates pain, that's a positive sign.
Yeah, that's a telltale sign of a tear.
Yep, that means this is not 100% sure, but it's pretty likely.
Sometimes, at least rotator cuff involvement. Anyway.
Right,
I
there
mean,
you
it
go.
might be really fired up.
Now let's go to the second one. This one, Bob, he's got his arms out, 90-degree bend in the elbow. Let's say this is the shoulder in question, or let's have this one. Now face me, Bob. Now this is the one that hurts. So I'm going to go to the good one. Face the camera now, Bob. And I'm going to push in this way, and you hold strong. Now he's real strong there. Now I'm going to go to the other one. I'm going to do the same thing. I'm going to bring pressure this way.
Oh.
And it usually falls right in too. A little pain, and it's very weak. If it's very weak and it's painful, it goes in, that's a positive sign.
Yeah,
if
positive meaning that we think you might have a tear.
Right, exactly. Number 3, this one you can do all by yourself.
Yep.
It's called the lift arm test. So you put your hand behind, and do this with your good one first. Palm is away, so it's touching like where your belt is, and you're going to lift away like this. There you go. So
you can see I'm lifting away from the body.
Right. Do it with your good arm first, and then try it with the sore arm.
And what you might find with the sore arm, you might not even be able to get it up here.
Right.
You might only be able to go down here.
Yep.
And then try to go
Yep.
up.
And that's leaning towards a positive sign.
Right.
So if you can get up there and you cannot lift it away from your body, it's positive. Another indication you've got a rotator cuff tear. So good luck with these. Do
we
all
got to tell
of
what our
them.
giveaway is.
Oh my goodness, yes.
So this week we're giving away actually a device that's going to help you strengthen your rotator cuff.
There
we're
you
giving
go.
you the wall anchors. So can you come over here, Mike?
Yeah,
So
go over there, Mike.
there's 4 of them. If you buy them from our website, if you get them from Amazon, there's 3. We'll also try to get a discount going for you because we love you. Yeah, Brad, grab a band here. So
Yeah.
what's nice about these is there's just a myriad of ways to put these bands on here and attach them. You can slide them through the middle like this. And I got 2 sets of bands on this thing, so it's a little heavy duty.
Yeah. Now we use these anchors with the bands for rotator cuff strengthening all the time.
Right.
But if you want to show one of the exercises.
Well, I was just going to show chest.
Okay. Yeah, because actually you got too much weight for rotator
Yeah,
cuff.
I got a lot of weight on there right now, so you can actually get a decent workout with this. I mean, Brad, you use this for all your strengthening, don't you?
Exactly right. All of it. I have a complete program. It takes me about 45 minutes to get through. This is what the anchor looks like. There's long screws. It must be secured into a wooden stud. There's no options to that. So that is one thing that you do need to know. But we have one high, one medium, one low for different exercises.
And what's nice is once you have it hooked up, they don't slide
No, yeah.
if you have them hooked up right.
The whole system is, there's nothing else like it. That's why
we're real proud of it.
We are. So yeah, again, you can get a set of four of them as the giveaway.
If you use the link for our website.
Right.
So,
but it's a giveaway too, right?
oh, it's a giveaway too. Yeah, you can sign up for the giveaway. See if you won.
Right.
If you win, we'll still reimburse you too.
You bet. Absolutely.
All right. Thanks for watching.
It's just the way we are.